You know, we're all obviously going to miss Sally Fox tremendously. And what I have said is that I'm going to let the process work. I'm thrilled that Michael Stockton is interested in the job. As you know, most of us just learned that. And we'll let the process go forward.
What qualities are you looking for in a replacement for Sarah Fox?
Well, what I always look for is someone who can represent Chittenden County with distinction and who is able to, in this case, make sure that we carry on the legacy of Sally's, which was a real deep concern for folks, for children, and for folks living in poverty.
And would you definitely choose someone from the list that is submitted to you? I know sometimes you have and sometimes you haven't in the past.
You know, I'm not going to comment too much on it until I see if there's a list or who's on the list, for the simple reason that, you know, I think as Kyle just suggested, the dynamics have shifted significantly in the last 12 hours, and therefore I'm just going to let the process work.
Do you have any reservations about someone jumping from active lobbying to a Senate seat?
You know, as I said, I'm not going to comment on the process until I see who I actually have to consider before me.
I think the question was more about the merits of the candidates, though.
And I'm not going to get into the merits of the candidates until I know who the candidates are.
Why shouldn't somebody who has a 50% disability get a free license?
Why shouldn't somebody?
Yeah.
That's an interesting question. I mean, obviously, we've got a threshold to fix. I think the Veterans Advisory Council and legislators felt that moving from 100% to 60 was the most logical first step. We can look at, you know, whether we hit the right number or not in the future.
And was it based on just an analysis of how many free licenses you'd be giving out if
Well,
you did that?
what we really looked at is what other states are doing as well. Maybe I'll let the commissioner take that. He did most of the legwork.
The federal threshold for disability eligibility as a disabled veteran is 60%. So that's what a number of our neighboring northeastern states have chosen as a threshold to, you know, offer some kind of benefit like a free hunting and fishing license. So we're simply trying to meet and match the federal standard for eligibility jurisdiction. Thanks.
Thanks for saying that.
Governor, what do you think of Senator Galbraith's proposal for financing universal health insurance?
You know, I think that starting the conversation about how we're going to move from healthcare premiums to a more fair way of paying for healthcare is all good. And I think the conversation is a really important one. As you know, I've got a group working very actively to come up with the various options for moving from healthcare premiums to a fairer system. I think the first thing that we all need to do together is look at the existing system, see who's paying what, when, how, and how regressive or progressive it is. And you know, one of the problems with the current system, which I don't believe anybody would design from scratch, is that none of us really know who's paying what. I mean, when you look at property taxes, for example, what gets shifted there. When you look at so many of the costs that we just absorb, we haven't really done a good job of defining what's driving those costs in healthcare. So we'll continue to do the good work.
But you'd likely use a similar mechanism. You'd probably follow, or you'd rely on the payroll tax.
I didn't say that.
So would you not, or?
I didn't say that. I said we are developing ways that we could replace healthcare premiums with a fairer system where everybody pays according to their ability to pay.
He says that in order to get the system up and running in 2017, that this question should be resolved this session, but you feel like it should not be voted on until next session. Is that correct?
It's tough to vote on something when it's not ready to be voted on.
What about his point that we need to start generating revenue well in advance of January 2017? He puts the figure at $400 million. How are you going to pay claims on the 3rd of January 2017 if you haven't generated some revenue in advance?
I think as we try to move to a new delivery system and a new way of paying for it, that's the least of our challenges.
But
Or low on the list of our challenges.
But wouldn't that argue, though, that you're going to need some some money in the bank before January 2017?
You know, as you know, we're trying to map a course that is achievable, that can get the job done. And that's one of the things that we'll consider going forward. But there's no reason in 2014 that you need to start piling up money.
Senator Galbraith has argued that in order to receive a waiver from the federal government, we need to have a plan ready to go by May. I'm guessing, given your stance, that that's not something you agree with. Can you comment on that?
You know, I mean, I know that you all are trying to get me to agree or disagree with a particular senator. What I'm saying is, this is a conversation that, as you know, has many moving parts, is complicated, but incredibly important. And I am firmly committed to moving Vermont to a more sensible healthcare system where we spend less money for better outcomes, because the current system will bankrupt us. It's not sustainable, which is kind of a big deal when you're talking about healthcare. We're not talking about the corner grocery store here. And secondly, where we pay for it in a smarter way. I mean, it continues to baffle me. If you said, let's design a healthcare system from scratch, and you said, you want to hear some ideas on how to pay for it. If you propose the current system, you know, where you have a healthcare premium and some folks choose to pay for it and some folks choose not to, and the ones who choose to pay for it pay for the ones who choose not to, you know, you'd say, come on, that's not a plan. That doesn't pass the laugh test. So the first thing we have to do is look at what we're doing, why we're doing it, how we're doing it, and what effect it has on jobs, economic development, and Vermonters' pocketbooks.
But is getting a waiver contingent on doing something this year?
No.
You said if we can't get cost containment right, then we're not going to move ahead with public financing.
Yeah, I mean, just to be really clear about that, there is no financing system that will support the current system. I mean, we're spending 20 cents of every dollar we make on healthcare right now. If costs grow at the same rate for the next decade that did for the last decade, those will double. And I have yet to meet a Vermonter who raises their hand and says, I think if in the next 10 years our healthcare spending doubles from 20 cents on a dollar, we think that's a prescription for economic growth and for good, solid economics for our families.
Right, so I'm just wondering, what's the criteria for knowing that you've gotten cost containment right?
Bending the cost curve. In
Right,
other
so
words,
what specific metric are you looking at to
Well,
know whether or not?
Well, as you know, we have a SIM grant that's going to allow us to work together, and Algo Bay and Greenmount Healthcare Board is working together with our providers to take a part of our delivery system and move it from fee-for-service, quantity-based reimbursement system, to one that's based upon outcomes. And I think that's going to give us a platform to look at a part of the system and say, hey, this is the kind of reform that would make sense.
Right, but I don't think the results from that are expected to be in until after the 3-year grant is finished.
I'm confident that we will have, that as we go forward, we'll have a good vision among our providers and among the larger Vermont community that we're on the right track.
So it'll just be kind of a consensus. What's the sense among providers? Is this working, is it not, as opposed to a specific set of empirical metrics that you're going to look to say we've got cost containment right?
We're going to use everything that we have available to us to determine whether we think we have cost containment right.
And when do you have to know the answer to that question in order to have the system in place by January 1st, 2017?
Well, I think that's one of those questions that's impossible to answer.
But you're going to have, you'll have to know the answer to that question at some point, right? In order to.
Well, sure we will, but here's the point. As you know, I've become a little weary of trying to get committed on particular dates around healthcare. So I believe that we're on track. I think we have a conversation going on in Vermont in terms of containing cost and shifting our delivery system that's unprecedented in the country. We've got our hospital CEOs, we've got our docs, we've got our providers working together with the board to come up with a more sensible system, and I think we're going to do it.
So is 2017 still a good timeline for us to be using, or is it January 2017 the goal?
It is the goal that I would like to reach.
Are the facilities in Kentucky that we're using for prisoners adequate? We just found out yesterday that more than 200 inmates are involved in some kind of fight with management there. They're in lockdown mode.
Well, you know, we're always evaluating our correction system, both in-state and out-of-state. We'll continue to. Having said that, you know, I have confidence that we're making the decisions that best deal with the rising population or the corrections population that we're dealing with. I haven't had time to delve into the details of exactly what's going down in Kentucky, but obviously we have confidence and have had confidence in our out-of-state placements.
So you
Or we
feel
wouldn't be doing
confident
it.
about the upcoming negotiations with CCA and the contract, that we've extended a contract and it's...
I have confidence in my commissioner to negotiate a smart contract and an appropriate contract.
Do you see out-of-state prisons as an inevitable continuing thing?
Well, I mean, you know, let's be candid about this. Our corrections population is such that we don't have enough in-state beds. So we're being very creative and aggressive in trying to reduce our number of incarcerated folks. I spoke to that in my State of the State address. As you know, 80% of the folks that are incarcerated are in on addiction or addiction-related charges. And we're working hard to try to bend that curve by being much more innovative with treatment and dealing with our drug problems as a healthcare challenge and not just a criminal challenge. So I'm optimistic that we can make progress, but I wouldn't dare to speculate on what I don't know, which is if ever or when we could stop using out-of-state beds.
Governor, you presented your budget last week and noted 3.5% increase in general fund spending. Even members of your own party are now starting to say, well, it looks like it's really close to maybe 5%. And you use some budgeting methods that you've never used before. Can you just clarify?
Sure. I don't think we're using budget methods we've never used before. Listen, my team and the legislature don't disagree on the numbers. If you look at our budget book, you'll see that we agree with the same analysis that they're making. My point in my speech was, and it's important, that what's been driving spending in Vermont has been the fact that, frankly, before I was governor, we were lucky enough to get a lot of ERA funds, one-time funds, which saved us from the worst recession in American history. And that as we wean ourselves from the funds, and I'm proud of the fact that we're reducing it considerably this year, when you look at year-over-year spending, you have to take into account that we backfilled. The good news is that we backfilled a good part of last year's one-time money. So that's relevant. And you know, you can look at it from the other side too. Here's the point. I am proud that I've now submitted my fourth budget that had to close a deficit, match Montpelier's appetite for spending with Vermonters' ability to pay by not raising income taxes, sales taxes, rooms and meals taxes. So I don't think too many would argue that we're not on the right track. You know, we're on the right track. We've made smart investments in this budget. It's financially and fiscally sustainable. It protects those that need us the most, and it protects Vermont taxpayers by not asking them to pay taxes that are already too high.
So what is the actual general fund growth in your proposed budget?
Well, as you know, we do not disagree with the numbers that were outlined in, I believe it was your story yesterday. So if you take out the one-time or you look for the progress we're making there, my number is correct. If you add it back in, their number is correct. We don't have anything to bicker about.
Okay, if you have a 5% increase, how can you then tell people to go back and scrutinize their school budgets if they're less than that?
Well, that's a good question, and let me give you the answer. If I had a 20% reduction in my caseload at the Agency of Human Services, I could lay people off and reduce my budgets, but I don't. I'm working in an environment where my caseload is increasing, where the federal government is cutting back on programs that keep Vermonters from freezing in their homes in wintertime, cutting back on 100,000 Vermonters who are food insecure, can't put food on the table for their families. And Vermonters are making a judgment that while we know we can't fill the holes and the foolishness of the federal government, we can make sure that we make small investments to make sure that no one freezes in their home or freezes in the streets. What the school boards are looking at, and what we're looking at for property taxpayers, is a caseload that's dropped 20%. 20%. Fewer students, more staff, rising property taxes. So my message to school boards is pretty simple. You're doing good work. Keep it up. But if you see double-digit increases, and the state of Vermont does not have a double-digit increase, scrutinize those very carefully and ask the simple question, is there a way that we can reinvent what we're doing to help stop the unsustainable rise in property taxes that the Vermonters that I talked to were pretty concerned about?
Given your analogy, are you suggesting that school districts should be looking at consolidation or laying off teachers?
I think school districts should do, and they are doing, I'm not criticizing them, they are doing everything they can, but there's more we can do to look at every single way that we can still deliver quality education in a state while containing cost. And it's not a secret to anybody that we've got more administration, that we've got more bureaucracy, that we've got and that we've got among the highest per pupil spending in the country, in America. So the answer now is not more money. The answer is when you have 20% reduction in your student count, which we do in this state, it's a lot of children that we're not educating anymore. How can we find efficiencies so that property taxpayers don't keep getting kicked in the teeth? And one reason I feel strongly about advocating for this the way I have is that there is the misconception out there that somehow Montpelier decides what your property taxes are going to be. And my point in the speech is pretty simple. It's not true. School budgets are passed on the first day, Tuesday in March, and that your spending is what impacts your property taxes.
So if you were a school board member, what would you be looking at to reduce right now?
Well, I'm not,
But you're asking them to do it, so
as
what kind of things would you be looking at specifically?
I would look at every single expense and ask the question, how can we do things differently in light of dwindling enrollment, fewer students, to be more efficient?
Any specifics, though, types of things that they should be looking at? I mean, I think most people would agree that.
I think most people who manage a school budget have the wisdom to look at those areas without the governor telling them what they are.
But are
You said you had small investments in the human services programs. So $225 million additional money is a small investment.
Sorry, say that again?
$225 million in additional spending on AHS, that's a small investment.
I think that our overall rate of growth is what we're talking about. As you know, it's a $5 billion plus budget. So when you convert it to millions, it ends up, you're talking about real money. But here's the point. We are managing this state with fiscal discipline that Vermonters should expect of a governor. And we're doing it without raising income taxes, sales taxes, rooms and meals taxes. I'm proud to present my fourth budget that does that, and we're going to stay on track. Vermonters don't want a governor who's spending money we don't have, and finding a balance between taking care of those that need us, paving the roads, rebuilding the dilapidated bridges, and being fiscally responsible is really what we're all trying to do here.
Is the list of one-time monies that we're spending complete?
I don't understand the question.
Well, it seems that there
Help
are a
me
few
out.
items that aren't on the list, like the so-called Leahy bump under the Affordable Care Act.
Well, you better take that
And,
one up with,
and additional insurance monies, those things add up to another like 20 million, so it looks like your one-times are closer to 50.
well, I'm going to let you argue that one out with Secretary Spalding, Jim Reardon, and the team that put the budget together.
So where is the bar for scrutinizing a school budget? Is it 10%? You just said double digits, but I thought previously you had recommended more about 3%.
Let's be clear. We have a problem in Vermont. I don't think this is when I go out and talk to Vermonters, this is what they tell me. They don't understand why, when we have 20% less students than we had just a few years ago, why overall staff goes up and their property tax bills keep going up. So, this isn't an exact science. What I can tell you is the Vermonters that I talk to say, let's find a way to ensure that our school spending is matched with our ability to pay. And there's a feeling across Vermont right now that that's really not the case. So we've all got a role to play. As you know, the legislature is looking at the funding formula with us. All I'm asking, I don't think this is such an unusual request, is that school budgets continue to do their good work of looking very carefully, scrutinizing very carefully how we can do things differently, so that this trajectory where property taxes keep going up and our student count keeps going down doesn't continue. I don't think this is a real controversial conversation.
What do you make of the succession of stories coming out on the Christie administration?
To be candid, I'm too busy being governor to spend too much time thinking
You
about
haven't
what's
read any
happening
of them?
in New Jersey.
You haven't read any of them?
I've read a few of them, but I gotta tell you, of all the places that I wanna live in the world, New Jersey's at the bottom of the list, so I don't pay that much attention to it.
But you paid attention to New Jersey politics for obvious reasons. What do you, I mean, are you concerned by some of the allegations that you're hearing?
You know, I'm gonna focus on my job, which is being governor of Vermont, and I'm gonna stay out of the conversation about what's going on in New Jersey or anywhere else.
Why?
But one of your jobs is chairman of the Democratic Governors Association, and Ken Cuccinelli, the Republican nominee for governor in Virginia, has suggested that Christie should step down from his leadership position in the RGA. As leader of the DGA, do you agree that he should step down from the RGA?
I agree that my job is to help oversee the DGA, and I'll let the RGA decide what's best for the RGA.
Thank you.
Under
Thanks.
what circumstances would you order lane closure over the Winooski? If Michael Bryan stepped out of line, for example.
How do you know what I was up to? Thanks so much.
And I just want to say for the record, those are in the 30 place.